Welcome to this pediatric nursing masterclass focused on hypoxia, essential knowledge for upcoming exams like NORCET, RRB, ESIC, and DHS. Hypoxia is defined as a state of reduced oxygen supply to the body's tissues and cells, which is insufficient for normal function. Oxygen is critical for cellular metabolism. Insufficient oxygen leads to anaerobic metabolism, resulting in lactic acid buildup, metabolic acidosis, and ultimately cell death. It is important to distinguish between hypoxia and hypoxemia. Hypoxemia is low oxygen tension in the arterial blood, defined as a PaO 2 below 60 millimeters of mercury. Hypoxia is a low oxygen supply to the tissues, which may occur even with normal blood oxygen levels, such as in cases of anemia. Let's quickly check your understanding. The term for low oxygen concentration in the arterial blood is hypoxemia. The four types of hypoxia are hypoxic, anemic, stagnant, and histotoxic. Hypoxic hypoxia is caused by insufficient oxygen entering the blood from the lungs. Examples include high altitude, pneumonia, asthma, and airway obstruction. Anemic hypoxia occurs when the lungs are working well, but the hemoglobin is unable to transport sufficient oxygen. This can be caused by severe anemia, hemorrhage, or carbon monoxide poisoning, where CO binds strongly to hemoglobin. Stagnant or circulatory hypoxia means the blood has oxygen, but the circulation is impaired, preventing fast enough delivery to tissues. Causes include congestive heart failure, shock, and local vasoconstriction. Histotoxic hypoxia occurs when cells are poisoned and cannot utilize the oxygen delivered to them. The classic cause is cyanide poisoning, which blocks oxidative phosphorylation in the mitochondria. Quick check number 2. The type of hypoxia that occurs in carbon monoxide poisoning is anemic hypoxia because the hemoglobin cannot carry oxygen. Pediatric respiratory causes of hypoxia include airway obstruction from foreign bodies or conditions like croup, lung issues such as pneumonia and bronchiolitis, and chronic issues like asthma or cystic fibrosis. Pediatric cardiac causes often involve cyanotic heart defects, where deoxygenated and oxygenated blood mix, such as in tetralogy of Fallot, or heart failure, which affects the pumping ability. Early clinical signs of hypoxia can be remembered with the mnemonic RRAT: restlessness, anxiety and tachycardia, and tachypnea. Restlessness is typically the earliest sign. Late signs of hypoxia can be remembered with the mnemonic BED: bradycardia, extreme restlessness leading to stupor or lethargy, and severe dyspnea. Bradycardia in a distressed child is an ominous sign. Pediatric distress signs include nasal flaring, retractions where the chest wall sinks in, grunting to keep alveoli open, and head bobbing. Central cyanosis affects the lips and mucous membranes and is always pathological, indicating severe hypoxemia. Peripheral cyanosis affects the extremities and may be normal in newborns for the first 24 to 48 hours. Based on the RAT mnemonic, restlessness is an early sign of hypoxia in a toddler. Bradycardia in a child with respiratory distress is a late and ominous sign, indicating impending respiratory arrest. Pulse oximetry measures oxygen saturation. Normal is above 95% on room air. Nursing alerts include rotating the sensor site, noting that cold extremities yield inaccurate readings, and ensuring nail polish or henna is not interfering. Arterial blood gas, or ABG, analysis provides detailed information on blood oxygen and acid-base balance. The normal 2 range in arterial blood is 80 to 100 millimeters of mercury. Management principles include positioning the child in semi-Fowler's position and administering humidified oxygen, treating it like a drug. It is also vital to treat the underlying cause, such as nebulization for asthma. Nasal prongs deliver 1 to 4 liters per minute in pediatrics, offering 24 to 40% FiO2. They are comfortable, but require humidification if the flow is high. Simple face masks require a minimum flow of 5 liters per minute to flush out carbon dioxide, delivering 40 to 60% FiO2. Venturi masks allow precise oxygen concentration control and are often used for COPD patients. The non-rebreather mask provides the highest concentration of oxygen without intubation, delivering 80 to 95% FiO2 at 10 to 15 liters per minute. It is used for severe hypoxia. The oxygen hood, or head box, is ideal for infants and neonates, providing warm, high-humidity oxygen that is well tolerated while allowing access for body care. A major complication is retinopathy of prematurity, or ROP. High oxygen concentration in preterm infants causes retinal vasoconstriction, followed by abnormal vessel overgrowth, which can cause blindness. Oxygen toxicity can also lead to bronchopulmonary dysplasia, a chronic lung disease in neonates from prolonged high oxygen exposure. Atelectasis can occur from high oxygen washing out nitrogen in the alveoli, causing collapse. For a 4-month-old infant, an oxygen hood is the best method for administering oxygen. Retinopathy of prematurity is primarily caused by a high concentration of oxygen or hyperoxia. Effective oxygen therapy is indicated when the child is pink and sleeping peacefully, showing improvement in color and behavior. The minimum flow rate for a simple face mask is 5 liters per minute to prevent the rebreathing of carbon dioxide. Nursing diagnoses include ineffective airway clearance and impaired gas exchange. Interventions include suctioning the airway, humidifying oxygen, chest physiotherapy, and encouraging fluids. Key points to remember include that restlessness is an early sign, bradycardia is a late sign, the Venturi mask offers the most accurate delivery, and the non-rebreather mask offers the highest concentration. This slide summarizes the 4 types of hypoxia: hypoxic, anemic, stagnant, and histotoxic. In a scenario where a child's SpO2 is low with severe retractions on a nasal cannula, the priority nursing action is to immediately escalate to a non-rebreather mask, elevate the head, and notify the physician. Remember, belief in your abilities is key to success. Never give up on your goals. Thank you for watching this video. All the best for your competitive exams.